I'm very happy to be here for the second time. Last time I had given a lecture on mistakes during choosing research topics. And this time, ma'am has given me a topic close to my heart, that is an overview of systematic review and meta-analysis. This is where I work, Ramakrishna Dental College and Hospital, Coimbatore. So I expect that at the end of this lecture, you will have some idea of what a systematic review is, what is the purpose of a systematic review, and an overview of the process of systematic review and meta-analysis. Now, before going into what is a systematic review and why it is done, let us take a real-life example. You are planning to maybe buy a mobile or make travel plans and make hotel bookings. You just don't step into it immediately, right? What you do is you research the available option. For example, what kind of smartphone you want, what is the price range, what are the specifications like the RAM, storage, what is you have zeroed on a few brands, you compare those brands, and you come across a lot of websites. Each website tries to show you that one brand is superior to another. Similarly, when you're making travel plans, you decide on the destination, your tenure of stay, your budget. And then again, there are so many websites like MakeMyTrip, Booking.com, everything gives you different deals. But there are different reviews which give different ratings, which give different rates. Which one should you trust? So now, when we are planning to buy these things, what we do is we uh, try to go to websites which compile all this information together and give the best evidences. Like GSM Arena, which is known for highlighting the most relevant tech reviews, and sites like Trivago, this is the only one I know, which will compile the prices from all available. So you don't have to visit each and every website to research. All this is done for you by a single website. So that is what a systematic review in essence does for you. It takes a clearly formulated question and uses systematic and reproducible methods to identify, select, and critically appraise whatever available research is there. And once it has compiled, it will analyze all this data included in this review and give you its own interpretation. So let us see this with the help of an example. In the clinics, you take a simple case scenario. A patient has come to you with a painful tooth, and you wonder whether giving a non-steroidal anti-inflammatory drug before the endodontic treatment will reduce pain during treatment or even after the endodontic treatment is completed. Now, if you want to find an answer to this and you start looking up articles, you ask your teachers first and they said, okay, find out which is the best drug. What is the available evidence on different drugs that are available? You find there are different researches which suggest that one non-steroidal anti-inflammatory drug is better than the other. So many publications are there which come with different conclusions, which for each article, there may be a different reason why this conclusion has come in place, because there can be difference in patient population, the sample size may be different, there can be a difference in intervention protocol, the method of comparison itself might be different. And if for any study, a rigorous methodology is very important. So if the methodology is lax, or if the methodology is not rigorous, there is a high chance that there is introduction of errors into the study, which we call a bias. And because of this, the study quality may become poor and will give you conflicting results with current publications. Because of so many articles, you have to critically appraise each and every study to find out whether this has been done properly or not, and then decide finally, should I consider this evidence or not. But with so many articles being published every day and being indexed in PubMed every day, more than 5,000 in PubMed every day, in fact, which evidence will you believe and how much time do you have to consider this evidence? When you're doing this, you come across a systematic review, which talks about NSAIDs for managing post-operative endodontic pain in patients who present with preoperative pain. Now consider the PICO as it was taught to you earlier. The population here is patients who have presented with preoperative pain and require endodontic therapy. And your focus area is non-steroidal anti-inflammatory drugs. So it is your intervention. And here, this systematic review took up a comparison with any other non-steroidal anti-inflammatory or even a placebo. And the final outcome which they wanted to assess was what was the relief from pain. But in this case, in the population, one more factor has been added, which is the type of study which can be included in the study. And those are randomized control trials. This study also has done a quantitative analysis in the form of meta-analysis and presented it as a graph, which is known as a forest plot. Now, how are you going to interpret this evidence and how is it relevant to your question? We already know that if patients report with pre-endodontic pain, after root canal therapy, there is a 25 to 40% chance that they may develop pain after root canal therapy. So that means that there is a need to find solutions for preventing post-operative pain. And there are different studies which are available which say that non-steroidal anti-inflammatory drugs are most recommended classes of pain reliever. What this study added after what they did a literature search after framing their research question. After framing the research question, they did a literature search and found out all randomized control trials which have been done on relief of post-operative pain after root canal therapy with NSAIDs. And then compiled this data together, did a qualitative analysis and also a meta-analysis. And in the end, they found that the solid evidence is available for ibuprofen 600 milligram. They said that definitely if you give it preoperatively, it gives relief from post-operative pain when compared to placebo. But when it comes to other NSAIDs, for example, you have ketorolac, you have aceclofenac, there is insufficient evidence to say that this is effective. So what have we learned from the systematic review? It says that yes, you can opt for ibuprofen, but if you're planning to opt for any other drug, tread with caution. And if you're planning a future research, yes, you can think of using aceclofenac or ketorolac as a preoperative drug. You can even go for other options other than non-steroidal anti-inflammatory drugs like corticosteroids for preoperative administration to relieve post-operative pain. So what did the systematic review do? It summarized all the available evidence and it also assimilated the data available from all the randomized control trials which were retrieved from a systematic literature search. And the systematic review also told us which treatment method worked and what is the potential for doing a future study. As a first year postgraduate student, when you read a systematic review, it helps improve clinical decision making by providing an evidence-based foundation because we have to practice dentistry based on findings of research, which we call evidence-based dental practice. And when you go through a systematic review, if you're planning a future research on the same topic, it can tell you what all were the lacunae in the previous research, which was included in the systematic review. They will be telling you what is the quality of each research, what went wrong with the previous research, what would have been improved with the previous research. Based on all these findings, you can improve the study design of any study that you're doing, be it an in vitro study, be it a randomized control trial, or even an observational study. When we consider systematic reviews are not conducted on population. The studies which are conducted on population can be either case reports, case studies, or observational studies such as cross-sectional studies, case control studies, and randomized controlled trials. These comprise what we call primary research. Now, critical appraisals of randomized controlled trials and systematic reviews and meta-analysis, they critically evaluate the results and the methods of all these studies and give you a filtered information. They give you a hierarchy as to which study is more reliable as compared to the other study. And these are called secondary research. To revise, primary research on a population, whereas secondary research is done on studies done on populations. Now, is there a necessity for doing a systematic review just for academic purpose? The most important agencies which conduct systematic reviews are health policy making bodies, because let us suppose you want to find out whether we should continue giving pulse polio drops for children beneath 5 years. There are a lot of studies which have been published and say what is the incidence of polio after introduction of pulse polio program. A systematic review would compile the results of all these studies, find out if it has been done in a reliable manner, and then finally give you an interpretation with the help of quantitative data or meta-analysis and tell you, yes, these studies show that there is a positive outcome after giving pulse polio drops. Apart from that, pharmacological companies, Cochrane collaboration, and clinicians and researchers like you and me can also take up systematic reviews to answer specific questions which are related to our clinical practice and disseminate this data to other dentists who can use it in their clinical practice also. So, clinical decision making is one of the most important benefits of a systematic review. Before I start with the process of a systematic review, there is always a confusion about a narrative or literature review compared to a systematic review. Most of the library dissertations that we do are based on literature review. Now, we can't take away from the fact that a literature review or a narrative review is an extensive research on what all has been done related to a particular topic. For example, you have management of endodontic pain. Now, if you don't have a comprehensive guideline, what is happening with endodontic pain management, you can refer to this narrative or literature review and find out what all has been tried. But this literature review does not have very specific question. What it does is it gives a broad overview of what are the methods available, what is the current research going on, and what was the current research findings. But it is not comparing anything, and it is not telling you which method is the best, which method is the most reliable. Whereas when you come to a systematic review, it narrows down your question to answer specific queries. And it has specific inclusion criteria. And it also, if possible, it's not possible in all cases if the data are not matching, it is also possible to do a meta-analysis. So if endodontic pain management is a broad topic, you can consider this topic effect of preoperative corticosteroids in patients with symptomatic pulpitis on postoperative pain after single visit root canal treatment. See how the question has been narrowed down. And another example, for example, you have an LD topic, effect of proanthocyanidin on dentin collagen or flavonoids in dentistry. You can narrow down this topic and make it as effects of plant extracts on dentin bonding strength. So the question here is on dentin bonding strength. Now, this systematic review can be done on in vitro studies. Similarly, you can have another topic, effect of collagen cross-linkers on dentin bond strength of adhesive system. So you can tweak the broad topic, try to focus on a narrower area, find out if a systematic review has been conducted so far or not, and then decide to go ahead with the systematic review. Now, before you start with your systematic review, go through a few systematic review that are slightly closely related to your topic, because you will realize that there are a lot of components which you may not be aware of when you're starting with a systematic review, and how they have been actually reported. What is the homework you need to do? What is the preparation you need to do before you start with a systematic review? These are all the components of a systematic review which are present in a publication. First and foremost, when you have a research query, don't start immediately with the systematic review planning. Do a search in your bibliographic databases such as PubMed and Embase to find out if someone has done a systematic review on this. We have many systematic reviews on the same topic, but the focus question would have one factor which varies from each question, because of which the systematic review, the ultimate goal of your work, of your extensive work, because systematic review requires a lot of homework, is to finally publish your findings, and this should not go waste. When you get started, define your research question. As yesterday you had learned that you have different methods to structure your research question, one of them being the PICO format. So for example, in this case where the authors are assessing corticosteroids in patients with symptomatic pulpitis on postoperative pain, the population is patients with irreversible pulpitis requiring root canal therapy. The intervention is use of corticosteroid and the time is preoperative administration. What is the comparator? Now, the authors have used a broad comparison. You can compare it, the randomized control trials would have compared it with placebo or with any other drug, and the outcome would be relief from post-operative pain. So this research question also defines your inclusion and exclusion criteria. Now, inclusion and exclusion criteria are for a systematic review are very important, because when you do your literature search, all the articles that you have retrieved, the deciding factor whether this article or this publication can be included in your systematic review or not are dependent upon your inclusion and exclusion criteria. So here, the inclusion criteria are randomized controlled trials and vital teeth. Now, in studies which have reported both non-vital and vital teeth, the authors have specifically said that if the data for vital teeth are reported separately, then we will consider it. Otherwise, the article may be excluded. So this is the in-depth level to which you have to go when you're framing your inclusion and exclusion criteria. Now, the type of studies which you can choose, earlier systematic reviews were being done only for randomized controlled trials or randomized clinical trials. Now, there are so many research questions, especially in dentistry, which cannot be directly answered through randomized controlled trials, especially in India, because you have so many factors like the population, the availability of the population, the rarity of the condition, the finances available. So you can think of doing systematic reviews for other types of studies, such as observational studies, which are essentially case control, cross-sectional and cohort studies, and even for in vitro studies. And if it is properly done, you will definitely get a good publish your article. For example, this is a article talking about dynamic navigation system. So here it is done on in vitro publication. So the inclusion criteria are permanent human teeth in vitro studies. The intervention is a dynamic navigation system, and the comparator is again broad. It can be either freehand or static guided endodontics. And what is the outcome the authors are looking for? It is the amount of dentin removal and endodontic axis cavity preparation. So this again is a very good question to assess whether dynamic navigation system is good when you're practicing endodontics on patients who have difficulty in accessing canals. Now, before you start working on your systematic review, it is very important that you plan your systematic review in a phased manner. So first is your research question, then comes your inclusion and exclusion criteria, then comes your literature search, Then comes how you are going to retrieve the articles. What is the method you are going to extract the data? Now, all these needs to be documented, and you have to have proof that you have actually done all this before you started with a systematic review. The best method you can show that you have planned the systematic review well is by registering your protocol of the systematic review in a good protocol registry such as Prospero, Cochrane, or Open Science Framework. So this increases the transparency of the method that you have done. A template, usually a Prisma P template or Prospero protocol template is available on their websites, which will help you write the protocol in a systematic manner. Now, once your protocol is published, the reviewers may call you back through mail and ask you certain doubts and clarification, which will actually improve the rigor of the methodology of your systematic review. Once that is done, you can start conducting your literature search. Now, what is literature search? Literature search retrieves all the articles or tries to retrieve all the publications which have been done so far on your topic of interest. So your search strategy should be such that you don't miss out any of the publication or any of the research that has been done on this topic. So you can use the help of bibliographic websites related to medicine and dentistry, such as PubMed, Embase, Cochrane Library, and Scopus. And there is a method to this literature search, which will be taught by Dr. Vivek in another lecture. And apart from that, you also have to use other methods, visit databases of universities, uh, see the poster and paper presentations, souvenirs of different conferences which have been conducted to find out if someone has done a research similar to your topic. This way, you will get a large database of all the possible publications related to your topic. And when you do it on a website, you have to use a keyword search, which again will be taught to you by Dr. Vivek. So this on the left side, you can see this is a strategy which has been used to do a literature search. Once all these articles have been retrieved, now you have to weed out those articles which don't meet your inclusion criteria. So based on inclusion criteria, for example, your studies were only randomized an in vitro study or case series or for example, in this study, the authors actually reported that they got 481 citations through database search and 37 citations through manual search. That is, they checked the references of all the selected articles and found out 37 relevant articles. So after abstract, first, what they did was they checked the title, not possible to include in this article. They removed those articles. And then the remaining, all the articles were downloaded and the full text was read to find out if they meet the inclusion criteria or not. So this was done for 28 articles, but only 5 studies fulfill the criteria. Now, each and every step that you have been doing to retrieve this article has to be documented using a flow chart. And the best method to do is using a preferred reporting items for systematic reviews and meta-analysis flow diagram, which is also known as Prisma flow diagram. And this helps to map the number of studies which you have identified, what were the how many articles were included, what were excluded, and what were the reasons for the articles being excluded. Now, all this, you have certain softwares also like Covidence and Ryan, which will help you document all this when you're selecting your articles. And each step of the article becomes, of your systematic review, becomes much easier when you use a Prisma checklist. A Prisma checklist tells you each and every step. Okay, you have completed your literature search. The next step is to select your articles. How do you go about it? Have you done this? Is this the way you are doing it? Is it correct or not? All this will be with the help of a Prisma checklist. Now, you have your selected publications or selected literature in hand. Now, what do you do with it? You have to do three things. You have to do data extraction, you have to do appraisal, qualitative appraisal, and you have to do quantitative appraisal. So for qualitative appraisal, you actually trying to find out how was this research conducted? Was there any chance that by using a particular methodology, an error could have been introduced, which would result in wrong interpretation of the result? This is called a bias or deviation from the truth. So how do you find this bias? You can't find bias directly, but you can find what is the chance of bias, which is also known as risk of bias. So to find risk of bias, there is a checklist which you will use to find, okay, was this randomization done properly, or was it just that even and odd patients were randomly allocated to different groups, or like Dr. Ajay Logani spoke yesterday about randomization and allocation agreement, whether SNOICs were used, that is sealed envelopes which were unidentified were used. So all these methods, whether this has been reported in the publication or in the manuscript or not, will help you decide what is the chance of bias in the study. So this bias can be divided into three. If they say that we didn't do randomization or there was no possibility of randomization, then the reported results carry a high risk of bias. Because in this case, opinions of the clinicians as well as the patients may count. But if the rigorous method of randomization was used, this will become a low risk of bias and the reliability of your study improves. So this tool, which is on your screen, is the Cochrane risk of bias tool. You can use this for randomized control trials or randomized clinical trials. Apart from that, when you have observational studies, you can use the Newcastle-Ottawa scale. You can also use Joanna Briggs Institute's critical appraisal checklist. The JBI checklist is available for a plethora of studies, for randomized control trials, for quasi-experimental studies, for observational studies. So in case you are using observational study for your systematic review, you can have a look into the JBI checklist. When you go to the website, it will give you all the checklists. You just need to click on what you need, and it is a downloadable PDF. You can use that for assessing the risk of bias. So here, the authors interpreted that the 4 out of 5 articles which were selected had an unclear risk of bias, whereas one study had a low risk of bias, which is again being reported. Now, the second thing is extraction of your data, which means that you essentially make a table, which is a summary of all the studies which have been included in your systematic review. So this is also known as a data extraction table or a characteristics of the included studies. So you have the authors on the first row and the demographic data. Now, in this case, only sample size and sample teeth have been included. If there are any other, the number of male patients, number of female patients, whatever you feel, when you were designing the protocol of your systematic review, you should have reported. And what is the case selection which was used? What is the interventional drug that was used? What were the outcome measures? How statistical data was used? Everything is present in the data extraction table. So anything which is a deviation from all this has to be again reported. And where will you report it? You will report it in the discussion of your systematic review. Now, this is to us. Previously, I had discussed a qualitative appraisal, which tells you the reliability of the reportings in these studies. But apart from that, we have to find out, right, that which you tell me which analgesic, which intervention, which method is better. So I have to do a statistical evaluation, which is also known as a quantitative appraisal, which is done through meta meta-analysis. Now, for a meta-analysis in a systematic review, it collects data from all the studies. Primary research would have collected data from the subjects or the participants of the study, which become the data points. Whereas for a meta-analysis, the data point is the raw data or the statistical data which has been given in the studies which have been selected for systematic review. So how do we do that? Collects the data from similar studies, and then you have to compare the data. For example, in this case, uh, pain after 6 hours, 12 hours, and 24 hours, where the parameters were tested. If one study reported only 6 hours and 24 hours, only that data could be compared between two studies, even though one study reported 6, 12, and 24 hours. And the method of measurement of the outcome should also be the same. For example, if they have used a visual analog scale instead of a numerical scale. Any study which used a numerical scale could not be brought into this comparison because the method is different. So once you have similar findings, you will do a meta-analysis, and this is graphically represented in the form of a forest plot. So if you see this, only 3 studies. Now there are 6 hours and 24 hours comparison. I'm showing you the 6-hour comparison of 3 studies which have compared prednisolone versus placebo. On the right, you see a graph, which is a forest plot. The squares that you see against each study, for example, El-Kadam, there is a square, Jalazade, there is a square. This shows what is the finding of each study. Whereas the diamond at the bottom shows the pooled effect, that is the combined effect of all these studies together, which tells us that when you give prednisolone preoperatively, there is a good chance that there may be relief from post-operative pain compared to placebo. So all this knowledge comes to you through interpreting this forest plot. So after you have analyzed your data qualitatively and quantitatively, you have to give a narrative synthesis, and in the form of a chart as the characteristics of the study, and also in the written text of your discussion if there is any deviation or if there is any unique feature of each study that you want to report. Because this will give you a knowledge that something extra has been done by the authors to find a new dimension to the research question. Apart from this, a great tool can be used to combine the qualitative and quantitative analysis to interpret the overall certainty of the evidence. The risk of bias gives you the qualitative data. A great tool can help you combine both, which will again be taken for you. So finally, in this review, the authors came to a conclusion that, yes, you can use preoperative corticosteroid to reduce incidence of post-operative pain, but they have specified that it is valid for single visit root canal therapy. So if you want to plan inter-appointment pain management, then you can plan a study, write all these PICO, but the population will be not single visit, but 2 visit or multi-visit. So this is how you can change your systematic review topic to a new one. And finally, remember, you have to publish your findings and update as necessary. To summarize, before you start your systematic review, check for existing reviews or protocols, and then formulate a specific question which becomes your aims and objective, and publish your protocol. Then design your search strategy, which will be based upon your inclusion and exclusion criteria, and conduct a literature search through databases as well as manual search. And then based on your inclusion and exclusion criteria, select your articles and then assess the articles for quality using risk of bias tools. And finally, extract and synthesize data using a meta-analysis if it is possible. And then finally, publish your findings. Now, systematic review is a very lengthy process and it involves a lot of steps. So there are a few challenges which we can face while conducting a systematic review. The first one is that now for a systematic review, you need to go through multiple databases. But the access to databases is limited because many databases are paid. So to mitigate this, you can collaborate with your institution's library for access. If that is not possible, you can collaborate with another investigator. You can associate, you can combine them, you can invite them to be part of your review team who are from a university or who are abroad and who have access to these databases. The major reason that we fall short of finding all the relevant articles is because of a poorly constructed literature search. So remember, the literature search strategy using keywords should be very comprehensive. Read articles, read systematic reviews which are related to this topic and find out how was the keyword search done. Apart from this, time management is a very important factor because systematic reviews are often lengthy processes. So here you have to have a timeline and give specific time allocations for each phase. Apart from this, one main problem that we faced while conducting systematic reviews was in accessing full text articles because many articles are paid articles. Now, this is something which is a roadblock, but it is easily crossed because all you have to do is mail the corresponding authors. In 90% of the cases, the authors of these articles will be willing to share not only their full text, but if you ask for certain data which are not represented in their publication, maybe because of word limits or figure limit, they will be more than willing to share it with you. So all you have to do is just shoot a mail to them. And as Dr. Ruchika had said, at the worst, what will happen? They will not reply back, but at least you would have tried, right? And for there are so many library dissertations that we do, uh, which are based on literature reviews. They give you a wide amount of knowledge on what is actually going on in that particular topic. But a literature review is very difficult to publish. So you can convert the topic to a systematic review by narrowing down the topic to a specific and answerable question. For example, your LD topic was efficiency of anesthesia in endodontics. You can modify it to make it as a supplementary techniques for pain control during root canal therapy of lower posterior teeth with irreversible pulpitis. So that will become a systematic review and meta-analysis of randomized control trial. Now, if you don't want to seek randomized control trials and you want to see more of observational studies, because that is a field which is being newly explored, you can talk about nerve-related adverse effects following mandibular nerve block anesthesia. So here, many case reports or case series, retrospective studies or prospective studies would have reported the side effects following a mandibular nerve block anesthesia. And you can conduct a systematic review for this topic. Now, topic which is extensively researched in SRM is a chitosan application in conservative dentistry and endodontics. The systematic review topic which you can take up in these cases can be a comparison of chitosan versus EDTA or any other irrigant. You can use MEDP, you can use even sodium hypochlorite and find out first whether any studies have been, any systematic review has been published on this topic. And if it is not, then you can take it as a systematic review topic. Systematic reviews can be also conducted on animal studies of different materials. So chitosan has been done, has been explored extensively in animal studies also. So you can find out preclinical studies which have been conducted on animals and conduct a systematic review in remineralization of enamel and dentin. Coming to a conservative dentistry topic like ceramics in dentistry, simplest thing can be what is the adhesion of any ceramic material after surface pre-treatment. This can again be for an in vitro study. If you want to do a randomized control trial, you can see how much was the margin, whether the people evaluated the marginal integrity of 3D manufactured crown. You can see the clinical performance of ceramic and resin inlays. You can even see if 3D printing restorative materials have been done, what is the accuracy of these methods. So these can involve your in vitro studies, these can be your RCTs or observational studies. So finally, when you're planning to do a systematic review, the first advice I'd like to give is that whenever we do a systematic review, it is a territory unknown. So don't go into it blindly. Seek mentorship from faculty members. Maybe your first topic may not be good enough or it may not be feasible because though it may be very interesting to you, but a lot of research might already have been done on it. So try to narrow down your topic to what interests you, what is feasible, and focus on a well-defined question. But don't narrow it down too much that you end up having no publications on that topic. And try using open access journals and through institutional memberships to access databases and possible to collaborate with people who have read further about systematic review. There are two publications by the Cochrane Registry of Systematic Review and Institute of Medicine. So these are two freely available books that you can download. And there are different websites like Coursera and Cochrane, which provide training on systematic reviews. I would suggest that first you read up about systematic reviews. You go through a lot of YouTube videos about systematic reviews to get an idea what it requires. And then join a course because then you will be going in a little more with knowledge so that you can go to the next stage and ask a lot of questions. So to conclude, I'd like to say that systematic reviews contribute to evidence-based practice. Thank you so much to my department for giving me all the support in doing my research work, and to Dr. Mahalakshmi ma'am and Dr. Dax Ibrahim and Dr. Vidya for giving me this opportunity for sharing this topic with you. Thank you so much.